good afternoon, good evening, whatever time you are watching this from. This is me, Jamie Naftali, on the pediatric world. Welcome to my YouTube channel on the kids' welfare. This is the only channel whereby we teach mothers on common illnesses affecting children while growing up in a language that they can be able to understand. Welcome into today's episode, and we are continuing on HIV infection in children, and today we want to see measles with HIV infection. Measles and HIV infection. What is the relationship? Why specifically we want to know about measles? This is because measles causes severe illnesses in children with HIV infection, particularly those with advanced immunodeficiency. The advanced immunodeficiency means those children may be in stage 3 of this disease, of the HIV disease, or even stage 4. So we are saying measles causes even more severe illnesses. So this may occur in early infancy. When the child is so small, it may occur in early infancy in HIV infected children. So severe cases can occur without a typical rash and may be complicated by pneumonias or even encephalitis, the infection of the brain. So we are saying severe case may occur without a rash. We normally know that for you to know this is measles, there is that typical rash, the phenomenon, the rash that is symbolic of measles. So we are saying in these severe cases whereby the child is HIV infected, you may not even get that typical rash, and this may be complicated. It may complicate into getting pneumonias and also encephalitis, the infection of the brain. So it is this serious. So high case of fertility should be treated in hospital. When a child has got measles and they are HIV infected, it is advisable for mothers to take these children to hospital. So then how do we treat or manage this? This is by vaccination. This is more of prevention. We do the vaccination of measles, and this includes giving 2 doses of vitamin A. This is how we treat. We give 2 doses of vitamin A, and this is calculated based on the age of the child. Remember, we said in every case in children, when we are doing treatment is calculated as per the age and also per the kg of this child. So normally we give the vitamin A that we are giving, we are treating this with, is in terms of international units. So we normally do 50,000 international units to those small babies who are below 6 months. 50,000 international units. We do 100,000 international units for children between the ages of 6 months to 1 year. We also do 200,000 international units to children that are above 1 year. This is the dosage of the vitamin A. I thought it is good that you know this. So, and then B, please note that immunization should be given to HIV infected children at the age of 6 months, 9 months, and this currently the measles has been added another dose at 18 months. That is 1.5 years. What are we saying here? That we used to know a long time ago the measles vaccine used to be given only at 9 months, but we are saying currently they have added. So for the HIV uninfected, those children that have got no HIV infection, we are also doing 2 doses. We are doing at 9 months, and we are also repeating it currently at 18 months. That is 1.5 years. But for the HIV infected children, we need to do the 2. We start earlier. We give the measles vaccine at 6 months. We repeat at 9 months, just like a normal child without HIV infection, and also the current one that has been added, which is 18 months. We are saying HIV infected children get 3 doses, currently are getting 3 doses of measles vaccination at 6 months, 9 months, and at 18 months. While the HIV uninfected child gets 2, that is at 9 months and also at 18 months. I hope this is very, very clear. If you didn't know, there's another one, additional one at 18 months. Now you know. That was measles and HIV infection. How about septicemia and meningitis in HIV infection? First of all, what is septicemia? Sepsis means infection. Septicemia means infections in the blood. These infections in the blood. We also have meningitis. Meningitis is infection of the brain. Very, very dangerous. It has got a long-term as a consequence. You may have permanent brain damage. So meningitis, this is the inflammation of the meninges. So it is the inflammation of the brain. So septicemia and meningitis in HIV infection. So fever may be the only presenting symptom of serious bacterial infection. So these children may only present with hotness of the body, the fevers. The HIV infected children with fever need careful clinical and lab assessment to identify the cause of fever. So these children who are HIV infected and they have got fever, you need careful, take good history, physical exam. They also need good lab assessment, and also so that you may identify the cause of this fever. So they also need intensive follow-up. Don't leave it at there. We need to follow up this fever. So this is very, very important. Treatment should follow local guidelines. The treatment failure is more frequent here in HIV infected children. They also have meningitis and they have the septicemia, the infections of the blood. So treatment failure, we are saying, is more frequent. How do we prevent this meningitis and also this septicemia, these infections of the blood? So prevention is in terms again of immunization. During the immunization, so we immunize these children against the HIV. This is H influenza type B. We also immunize against the pneumonias, the pneumococcal pneumonia. This is causing now the septicemia. So this is it about the septicemia, meningitis in HIV infected children. How about skin infections in HIV? So we have bacterial infections in the skin, things like abscesses and something we call impetigo. Abscess is where there is accumulation of pus. They may have these pus infections that have got pus on the skin. They can have also fungal skin infections. These are the most common infections. They are more extensive and also they are more different. They are more difficult to treat than in the non-immunocompromised patients. So where the fungal infection again take advantage of the low immunity, so we are saying they are more extensive and more difficult to treat. Other skin infections in HIV infected children, we have the viral ones. Example, we have a common one called molluscum contagiosum. So molluscum contagiosum. We also have parasitic. Examples, we have scabies. Scabies is very common. It is a skin infection in HIV infected children. Now, how about malaria with HIV? So malaria may be associated with more severe disease. Those children with malaria, those children who are HIV infected and they get malaria, they may be associated with more severe diseases. The malaria may be associated with more severe disease, with HIV infections, and we have few reasons why this is the case. Because of the pre-existing anemia. The children with HIV infection, their HB, the level of blood is low. So already there is anemia. Anemia is low blood levels. Low blood levels. So already we have pre-existing anemia. That is why the malaria is going to be more severe. We also have malnutrition. These children with HIV are very much, most of them, especially in the advanced stage, they are very, very wasted. They have malnutrition. So because of this malnutrition, when they get malaria, they have more severe disease. Other reasons are low immunity. Already HIV infection has caused low immunity, so we have low immunity already, so the malaria is going to be so severe compared to those without the HIV infection. Also comorbidities, because these children, when I say comorbidity, I mean presence of other pre-existing infections, illnesses in the body. Like we said, we have the septicemia, the meningitis, the pneumonias. So the comorbidity, other pre-existing infections already there in HIV. We said opportunistic infections, remember in our previous episode. So then malaria is going to be more severe. So what are we saying in summary? in summary is that characteristics of common childhood infections in HIV infected children. So what are the characteristics of these common childhood infections in HIV infected children? Remember, all we talked about, the respiratory infections, diarrheal diseases. We have seen the measles in HIV infected children. We have seen skin infections and now malaria. So they have got the same pathogens as the non-HIV infected children. So it doesn't mean that the microorganisms causing these illnesses in HIV infected children are different from the uninfected children, the children who are HIV negative. So they have got the same pathogens, the same microorganisms causing these diseases, just as in HIV, non-HIV infected children. Also, in summary, the characteristics of common childhood infections in HIV is that they cause severe diseases. That one we have said, we have explained. They are likely to reoccur. They come and go and come and go because of, again, the low immunity. Also, in summary, they have higher cases fertility rates compared to the children who are not HIV infected. So they have got higher case fertility rates. So these are the characteristics of these childhood infections in HIV infected children. I hope this is clear. It was a long one. The episode was a long one. We needed to summarize on those childhood infections in HIV infected children. So now you know, at least you have the knowledge. Thank you so much for staying tuned. Thank you for subscribing. For those who have subscribed, thank you so much. If you haven't, please consider subscribing. Hit that red button. Subscribe so that you may be part of this wonderful family. Put on your notifications. Put them on so that you may be among the first person to know every time I post a new video here. Please, thank you so much for staying tuned. Thank you for your time to watch this. Till next time, bye bye.